So I'm Dr. Isabelle Amigues, your host for the UnabridgedMD podcast. It is my pleasure to have you today on our episode. And today I would like to discuss something that comes up quite often with my patients, in general, patients with chronic condition, and that recently happened to me. It's the stress associated with tests. So, what do I mean by that? So, I'll take the example. So, because of the history of cancer I have, which is considered high risk for recurrence, I have to do PET scan now every 6 months. And so a scan to make sure that I don't have any more cancer coming back and so on. And, I live my life pretty normally in between, but when the time for the test comes in, I get very stressed. And usually I can, usually I've realized that I've got techniques to help with the stress, and I want to share it with you. And I think recently my last PET scan, so it's all good. I'm glad. And I'm very grateful. But the last scan was particularly stressful because of all of it meant. And why I'm sharing this is just to realize. So for me, I'm going on my own. I'm not going to be an employed physician anymore starting January. And it's stressful. I've never been unemployed in my life. I've always been employed. I've always been salaried. And suddenly I'm on my own. And what does that mean in the US? It means that I need to find my own health insurance. And that's okay. I'm going to figure it out. And there's always a way to figure it out. But, having potentially a recurrence meant a lot of stress in my life. Like, what do I do? Can I work? Will I be able to do this? What if, what if, what if, what if? And then so I went into this spiral of stress. And at the same time, this fight into my mind of like, do I actually open my own practice, or do I stay, in an employed position that allows me to feel reassured in case anything happens? And I had to really face that fear and realize that I really need to do this to also prove to myself that I'm alive and that I'm going to do something with my life because I have this opportunity, because the cancer taught me that my life is not given and that it's an opportunity to rise every time. And I really believe in what I want to create, this holistic approach to rheumatology, and very soon a center of holistic medicine that will take, energy healing, movement, coaching, and really heal the mind, the body, and the spirit. And so I'd like to discuss with you some techniques that I've realized helped me, and that really helped me. I went back to it. I literally did the doctor to myself. I was like, okay, if I were my own patient, why would I tell this person? What would I tell me as a patient? And I was like, oh, well, I always do this. And I can see, the relief on my patient's face usually when I tell them this. And I can tell you, I had the relief by just doing this work on myself. So there's 3 things that I would like to discuss. So the number one, and it's accept that there is fear. So accept so that you can face it. Number 2 is remember why you are doing a test. And number 3 is to have several plans with reassuring outcomes. So let's go for the number 1. Accept that there is fear. If you have listened to the episode of fear, you know that I am a big believer that you have to face your fear. Doesn't mean that you get overwhelmed by them, but that you have to acknowledge them. So in my case, what was I afraid? I was afraid, like, what if this happens? It means so much more. It means that maybe I didn't have a complete discussion with my cancer. And maybe it means that I'm not meant to do this work and opening my own practice. Like, you start like thinking, okay, what is it exactly that I'm afraid of? Because after all, it's just a test, right? So I'm afraid of this, I'm afraid of that, I'm afraid of this. And you put it down, like you can write it down. And for me, like, it was really powerful to put this, because I was like, oh yeah, there's a lot that I'm afraid when it comes to this test, right? But then the second one is remember why you are doing the test. All right. So this is extremely important. And I think as physician, when we order a test, we know why we are ordering it. And I can tell you that we are not ordering tests thinking that, oh yeah, this is the proof that it's going to be over. No, we are doing a test to say, hey, let's find out if our treatment is working. Let's find out where you are right now to make sure that you don't need something else. Let's find out if you need a treatment. Let's find out if you need another treatment. Let's find out that your treatment is well tolerated. And that's really important. And, because I'm both a patient and a physician, I realize that as a physician, my mindset is so much more in this really hopeful place where I'm like, yeah, it's just a test. We're going to just look and see that you're on the right track. And so when I started having more fear, I had to go back to my physician mind because I was in a spiral when it comes to my patient's mind. And so I had to really go back. Remember why those tests are done. When it comes to this cancer, like it's to know that my treatment to make sure that I don't have any more cancer works, right? But it doesn't mean, even if I were to have something, it doesn't mean that there is no hope. There's always hope. And if there was no hope, I would not, doctors would not ask you for a test. They would leave you alone and they would be like, yeah, you probably should go to the Bahamas or whatever you like to do and just enjoy. And anyway, you should go to the Bahamas. I've never been, but you should go. If there's something that you want to do it. But I digress. The number 3 is have several plans with reassuring outcomes. What do I mean by that? All right. So when you do a test and you're afraid, so for example, I'll take again my example. I'm afraid. What if there's a recurrence? What does that mean? The treatment is not working and I get freaked out, right? And I'm like, no, okay, well, so imagine the treatment is not working, there's a recurrence, fine, we have other treatments. We are in 2022, about to be in 2023. There's a big, gigantic, billions amount of treatment. I can tell you in rheumatoid arthritis and in rheumatologic disorders, it's like every 6 months, I feel like I have to learn about a new treatment. And then you imagine all of those treatments with the combination of the over treatment, the older ones, you have a magnitude of possibilities. And you should never lose hope that we will find the right treatment for you. That's very important. Okay. So that's like one of the things. The other thing for me was, okay, what does that mean? Does that mean that I haven't heard what the cancer had to say? Well, you know what? If that's the case, then I can learn more from, cancer, because I feel like there's always something to learn from all of the obstacles that are coming into our lives. Another one would be, well, does that mean that I need to be salaried? Well, no, this cancer, like if it were to come back, does not mean that I change my life completely. Does not mean that I don't follow what passionates me. And so, right, I went through all of those fears that I had. So, right, like I had like a list of fears of the what if, what does this mean? And then I went and I basically had an outcome that was reassuring, right? Okay, there's a recurrence, that's fine. We'll treat it with another treatment. Like there's a recurrence, that's okay. We have our treatment. I don't have to do anything, etc. The thing though is that I still visualize the whole time a perfect PET scan, right? And I think that that's really important. Visualize yourself healthy. Visualize the perfect space. But in order for me to visualize this perfect PET scan, I had to look at the fears and make sure that I was like, well, what if? Yes, but relax, it's okay. And why? Because I didn't want the fear to overwhelm me. And if I had not addressed the fear, I would not have been able to visualize properly the best outcome, which is that the PET scan is absolutely normal. All right, so those are 3 techniques. I really hope that it helps. I know that the fear associated with tests or diagnosis can be so stressful and so high. But there's hope. I mean, 2023 is incredible, and like the medicine that we have in 2022 are incredible. The ones that are about to come in 2023 are even more incredible. Advances on medicine, I can tell you, like doctors have a hard time to keep up because it's incredible how much we have, and there are a ton of things that you can do. All right, so that's it for the episode today. I want to tell you about an opportunity that's coming very soon. I'm going to do my first workshop. So it's going to be a live workshop on Zoom or Google Meet. We'll see what works better. And it's going to be on December, I have to look, December 16, and I'm going to do it from 11 to 12 Eastern Time or 9 to 10 Mountain Time. And it's the same time. So 11 to 12 Eastern Time, it's easier, I think, to remember. And you're going to have, you have to, how do you call that, to choose to be a participant. So you have to give your email. Go to UnabridgedMD.com, and you will be prompted on a link to put your email so that you can have the link to participate. And we are calling this the Back to the Power. Back to the Power. It's a pun about Back to the Future. Because there's always this question of like, oh, I was in good health and I'm not anymore, but I believe that you can actually be better than before. That's my belief, and we'll work and we'll learn several ways to help you achieve the best health you can have without medication. Meaning that this is a workshop on non-medical approaches that have been scientifically proven to help. With mostly chronic inflammatory conditions. So I'm really going to focus more on chronic inflammatory condition, but I would tell you that for my cancer, when I had cancer, I did this and I continue to do this as well. So there is data also for cancer, but I'm a rheumatologist, so I speak more to patients with rheumatology. It will be an absolute pleasure to have you. So go over on UnabridgedMD.com and register. It's December 16 from 11 to 12 Eastern Time. And until then, it's an absolute pleasure. I really hope you can imagine a life where your doctor is here to support you, where you are taken in your whole and your globality, unabridged version of you, with an unabridged version of your physician. And I'm here for you if you have any question about a rheumatologic disorder and you think that you may have one, come and register on my website UnabridgedMD.com, as I will be opening my doors very soon. I'm really hoping for January, and I cannot wait to meet you. Have a wonderful day and take good care. Bye bye.